Hello, welcome again. So, today I want us to address this question. Can autism be cured? What can I do? Yes. Can autism be cured? And what can you do about it? This is a very common question right there. So, and I will also ask you a question. Why do you want to cure autism? Yes. So while you think about it, let me address the question. One, autism cannot be cured. Straight to the point. That is the answer. And one thing you have to know is it is only disease that they cure. Yes. You cure sicknesses, you cure diseases. But autism is not a disease. So you cannot cure it. Do you see that? So don't think of curing autism. So people have given you medications, they've recommended, you've read online, you've seen different things. They've asked you to use different supplements, nutritional supplement and so on, brain booster. They cannot cure autism. Yes, that is the fact. So why can't they cure autism? Because it's not a disease. Nutritional supplements will do just a normal job it will do for every children. So that is it, but it's not capable of curing autism. It's not a disease. So furthermore, so what can you do when autism cannot be cured? So autism is someone's nature, is just a difference in the brain which affects the way they do things, and they do things differently. Have you thought of asking yourself, if autistic children can learn, why can't I teach them the right skills to learn? That sounds interesting, right? So if they are doing things differently and you want them to do things in certain way, they can learn the skill. Yes, you heard me right. Autistic children can learn any skill you want them to learn. However, you have to be patient and understand their pattern of learning. That is all. It doesn't sound as easy as I am saying it, right? Yes. So, and this is it. For some autistic children, it seems they are learning so fast. And for some, it seems it's difficult for you to even understand them before even talk less of saying you want to teach them. This is it exactly. We can put them in levels depending on the the level of symptoms they show. We have level 1. A child can fall on the level 1, level 2 category, or on the level 3 category. This category is not just to scare you, it's just for you to know about the level of support you can give to the child, or that a child requires to do better. Yes. So if there is no cure, there is a level of support you can give to a child who is autistic, and the child will do better and independently in many domains of life. So the level 1, someone who is on the level 1 just needs support. Like someone will say, they can easily slip through the cracks. Someone on level 1, you might not even really know they have autism, but sometimes you can just notice some weird behaviors. The person just needs what we call support. They can learn. Sometimes they can even be in the classroom and teachers don't even notice so much difference about them, right? So just a little support, they will do well. The level 2 too can learn as much as the level 1. However, their symptoms are more pronounced. You can easily tell that, there is something wrong somewhere with this child. And this child needs support. So the child on level 2 needs more support than the child on level 1. And we call it substantial support. So level 1 is just support, level 2 substantial support. If a child who is on the level 2 category can receive substantial support, trust me, this child is good to go. Can learn everything what you want the child to learn. And the third one is on the level 3 category. Yes, and a child who is on the level 3 category needs what we call very substantial support, and the child will be good to go. Yes, you can see that the more pronounced the symptoms are, or the more clearer the symptoms are, the more the support they need, right? So we need to be up and doing. We need to be ready to give this child who needs very substantial support the level of support he needs to thrive. I mean, every child can thrive, every autistic individual can thrive if you provide the environment for the autistic individual. So a very substantial support is needed for a child on the level 3 of the autism spectrum. And there is a factor that determines the rate of progress. I mean, there is a factor, and which is early intensive behavioral intervention, EIBI. Yes, early intensive behavioral intervention. So if you fail to give this intervention early, the truth is, I mean, the child will struggle. Yes, the child will struggle. That is it. So if as soon as you notice a child is diagnosed of autism, I mean, or with autism, begin intervention. Begin intervention early. So if you didn't begin intervention early, the skill the child ought to have learned, the child has lost it. Right? I mean, you will now begin late, which it will not be easy for the child at that stage anymore. I mean, we all know it's easy for children to learn things easily. Yes. So when you introduce them to intervention early, they learn easily, right? And faster. It's faster, it's quicker than for you to delay. So for you to see quicker progress, start with intervention early, make it intensive, especially if the child is on the level 3 level 3 of the spectrum. Yes, once again, no cure of autism, but the good news is that your autistic child can learn skills to be independent. I mean, if you have more questions, ask me. Of course, why am I here? I will answer you. Thank you. See you next time. Subscribe, like, share, tell your friends, educate your society. I mean, let them know that, oh, this thing is it's not a death sentence. Autism is not a death sentence. Those that have given up, they don't know what next. I mean, share it to them, let them know what next. Thank you.